Hi, I'm Dr. Julienne. What is your name?
Hello, Dr. Julian. I'm Dr. Mohammed. This is your patient. She's the little baby on her mother's lap, and we are set.
Okay. Um,
Yeah.
Nice to meet you. What's
All
the
right.
what's the patient's name?
Mesunanta. Her name is Fatima.
Okay. So,
Yeah.
what does the mother do for a living? What is her occupation?
Okay. Kina aiki ne? Like aiki. The mother is not gainfully employed. She's a full-time housewife.
Okay.
Yeah.
Um, so what brought them in today?
So mene yake damunta? Me yasa kuka zo asibiti? Okay. Sai me kuma? Akwai zazzabi? To, kawai majina na fita a hanci? Okay. She says she brought the baby to the hospital because the baby is crying anytime she's swallowing. So anytime she's breastfeeding, the baby will be crying. The baby also has a runny nose, and she also has a fever.
Okay. Is
Yes.
would you mind asking the patient if the fever is continuous or is it on and off?
So zazzabin nan ya zo ya tafi ne ko kuma dai sai an bada magani ne yake sauka. Oh, all right. So she said the fever is actually continuous. It's only relieved by taking antipyretic.
Okay. Um, she said
Yeah.
that the baby had a runny nose. What color would you say is the mucus coming out of the nose? Is it clear or is it
Mene
colored?
kalan majinin da yake fita mata? Ki bata nono. Me kalan majinin? Okay, she said the secretion is whitish in color and is watery.
Okay.
Yeah.
Dr. Mohammed, would you mind asking the patient if you could have a look
Network in nan.
in the baby's throat?
Network in nan yana dan mana akwai dan difficulty a network. Yes, I'm with you now. Please, can you go on?
Oh, yeah, sorry, you froze for a second. Um, is can you take the temperature of the baby?
Network in nan yana mana.
Dr. Mohammed, can you hear me?
Eh, network in nan.
Dr. Mohammed, would you mind asking the mother if you could take the temperature of the baby?
All right. Yes, the temperature is 38 degrees Celsius.
Okay.
Yeah.
What does the inside of the baby's throat look like? Is it swollen or is it just red?
That's very good of you. It's inflamed. If you check the throat, you see that the tonsils are inflamed there.
Okay.
Yeah,
So I believe that the baby has an acute respiratory infection. So
that's
I
good.
would like to run a blood culture,
All right,
also a full blood count to rule out if the patient has anemia because she hasn't been eating,
all right,
and also a chest x-ray to see if there's anything wrong with the lungs, and a malaria
all right,
rapid diagnostic test just to rule out
all
that.
right, all right. Well, that's very good of you. You have done well. And so the test result, the culture result, actually revealed bacteria, Streptococcus bacteria, and the MP, the RGT was negative, and the full blood count result was within the normal limits. No anemia.
Okay.
So the chest X-ray was normal chest X-ray.
Okay, so for treatment of
Yeah,
the acute respiratory infection,
yeah.
um, broad spectrum antibiotics for the patient
All
to
right,
take care of the bacterial infection.
all right,
And for future prevention, just make sure that the patient is washing their hands regularly and keeping their hygiene good, and if possible, maybe a vaccine if it's available in your area.
Wow, that's very good. That's very good of you. You have done well. From the history, you were able to identify that this patient is having acute respiratory tract infection. You have done actually well. Some of the investigations you ordered, like the chest X-ray, just to rule out pneumonia, that is other lower respiratory tract infection, you did very well. And then you also ordered fluid blood counts to rule out other infections, to rule out anemia. Also, you've done very well, and to also rule out malaria. This patient could also be having malaria because of the fever. You've done well. Actually, it's commendable. And the treatment also, you suggested antibiotics. That's very good of you. And the prevention, you did well also. Good hygiene will also actually prevent the bacteria from getting into the body of the patient. You actually did very good. So congratulations, Dr. Julienne.
Thank you.
You're welcome.
Please thank the patient also.
All right. Tachewe Tagode. So she said you are welcome, and she's also grateful for what you guys have been doing to them.